Here to introduce our keynote speaker for this opening session is Rob Bassett of the Rotary Club of Mitchell Field in District 6270. Rob serves as District PolioPlus Chair, District Annual Fund Chair, member of the Board of Directors of World Affairs Seminar, and co-chair of our ambassadors for this conference. Please welcome Rob Bassett.
Thank you, Tom. It's my pleasure today to introduce our keynote speaker, Carol Pandak. She's the director of Rotary International's PolioPlus program. This includes administration, advocacy, financial oversight, grants management, volunteer engagement, communications, and fundraising support. She's the liaison to Rotary's International PolioPlus Committee. She works closely with the partners in the Global Polio Eradication Initiative, GPEI, including the World Health Organization, UNICEF, U.S. Centers for Disease Control and Prevention, the Gates Foundation, and Gavi, the Vaccine Alliance. Carol is a member of the Evanston Lighthouse Rotary Club. Please help me welcome Carol Pandak.
Good afternoon, everyone. You, Mary Beth. I needed the support. Thank you. Well, Rob, before you go, it is my pleasure to introduce, I'm sorry.
Oh, I forgot to turn the page.
So I have something to present to you, Rob. Rob is a Rotarian whose tireless commitment and creative spirit have had a powerful impact. He has been active in polio eradication since 2017 and became District PolioPlus Chair in 2022. At nearly every district event, he has been there sharing updates, manning tables, encouraging conversations, and inspiring action. Under Rob's leadership, District 6270 launched its PolioPlus Society with over 100 members. And in just 2 years, End Polio Giving has grown 50%. Rob has energized efforts with innovative events like silent auctions, pub crawls, one of my favorites, and this year's Pound the Pavement for Polio, which brought together youth exchange students, families, and friends. He has traveled across the district to speak and support local efforts and help foster international partnerships like the Flight to End Polio. This afternoon, we honor Rob for his passion, integrity, and unwavering belief that a polio-free world is within reach. Rob Bassett, on behalf of the trustees of the Rotary Foundation, I'm proud to present to you with the Regional Service Award for a polio-free world. And before we applaud, I will say that there's only 60 of these awarded every year. So you, out of the 1.3 million Rotary members around the world, you are one of 60 that are receiving this award.
Cool. Thank you. Thank you. Thank you, Carol. Thank you.
Well, thank you very much. So I feel like I'm going to build on some comments that have already been made about PolioPlus and polio eradication. So I'm so pleased to have been invited to this event today. And it is my honor to be here, and I've had the pleasure to work with the district governors here at TriCon, and Peter Bush especially has dug into polio. He likes to get in the weeds on things, and so I appreciate the opportunity to share so much information with you. So what I'd like to do today is provide you with an update on where we are in our polio eradication efforts. First, we'll talk a little bit about what polio is, just as a reminder of what this disease is. Then we'll talk about the eradication status update. We'll talk about Rotary's role, and then what every Rotarian can do to help us finish the job. So what is polio? Polio is an intestinal virus that can cause lifelong paralysis and even sometimes death. It affects children mainly under the age of 5 and circulates largely in areas with poor sanitation and hygiene. There's no cure for polio once you contract it, but it is completely preventable with a safe and effective vaccine. Now, Rob mentioned our Global Polio Eradication Initiative partners. So Rotary is a founding member of the Global Polio Eradication Initiative. And this partnership was founded based on Rotary's efforts to raise $120 million during our PolioPlus campaign in 1985 to 1988. But Rotary raised $247 million. And that really got the attention of the World Health Organization and UNICEF. So based on our efforts to raise funds and based on the legion of volunteers that we were working with largely in South America, in 1988, the World Health Assembly adopted the resolution to eradicate polio. So these are the 6 partners in the Eradication Initiative. And I'm really proud to say that the Gates Foundation joined the Global Polio Eradication Initiative after they made their first $100 million commitment to the Rotary Foundation for PolioPlus. So Rotary's had a long, long relationship with the Gates Foundation. So the Global Polio Eradication Initiative has 2 strategies. One is to interrupt the transmission of the wild polio virus in Afghanistan and Pakistan. And the second is to interrupt what we call the variant polio virus that's circulating largely in Africa. The strategy was set to go through 2026, but at the end of 24, it was determined by the Polio Oversight Board, on which Rotary sits, that more time was needed to stop transmission of both types of these viruses. So the strategy has been extended now through 2029, where we're looking to interrupt transmission of these types of polio viruses. So let's look at the progress on the wild polio virus. When we first began with our partnership with the Global Polio Eradication Initiative, there were 350,000 cases of polio every year in 125 countries. Now that's 1,000 children a day, either being paralyzed or dying from polio. Oops. Well, it won't go back. But so fast forward to 2024, and there are 2024, and there are only 2 countries that have never interrupted the transmission of the wild polio virus, and that is Afghanistan and Pakistan. And in 2024, last year, there were 99 cases of polio in those 2 countries, 75 in Pakistan and 24 in Afghanistan. So far this year, there have been 8 cases of the wild polio virus, 2 in Afghanistan and 6 in Pakistan. Another indication of our success in polio eradication is that 2 of the 3 types of the wild polio virus have been certified eradicated. And I like to say that creatively, the scientists named the viruses type 1, type 2, and type 3. So type 2 was eradicated in 2015, and type 3 was eradicated in 2019, actually on World Polio Day. So there's only one type of wild polio virus that continues to circulate, and that's in Afghanistan and Pakistan. Now there's another type of virus that is circulating that's called the variant polio virus. And most of those viruses are the type 2 variety. And this is a phenomenon that we saw coming up in 2016. And this happens when the weakened but live virus in the oral polio vaccine begins to circulate in communities with low levels of immunization and can revert to a form that unfortunately can cause paralysis. And we see this largely in Africa. So what did the Global Polio Eradication Initiative do? We developed a new novel oral polio vaccine that is more genetically stable and less likely to revert to a form that can cause paralysis. And it's important to note here that the issue is not with the vaccine necessarily, but with communities and children that are or under immunized. And since we've introduced this new vaccine, the number of type 2 cases have been reducing year on year since March 21 when it was first introduced. So this map shows the poliovirus cases over the last 6 months. So the red dots are Afghanistan and Pakistan. And what's driving transmission in Afghanistan and Pakistan today? So in 2024, the Pakistan government took a decision to repatriate all of the Afghan refugees back to Pakistan, or back to Afghanistan. And there are lots of Afghan refugees in Pakistan. So large swaths of people started to migrate across the country, carrying the virus with them. And so we've started to use more sophisticated technology to try to map these populations to see how they're moving into Afghanistan so that we can immunize them while they're on the move or find them in the communities where they're moving to. In Afghanistan, we're not able to go house to house looking for children under the age of 5 to vaccinate, which is the gold standard for a global eradication initiative. The current administration, the Taliban, allows what we call, well, they don't allow house to house, so we have evolved to a site-to-site methodology. And this is where groups of vaccinators will set up a little post around every 5 houses and call the people out to have their children immunized. And the challenge with that is that you don't know how many kids are in the house. You only know how many kids they might bring out. So we have to figure out strategies to communicate how to get children out of the house. And secondly, women are largely not allowed to participate as vaccinators anymore in Afghanistan. They can in the east, in Jalalabad, but not in the rest of the country. And that's a challenge for the program because it's women who can enter the homes when the mothers are at home. A man cannot enter the home. So again, we have to find creative ways to get these children vaccinated as we move forward. So we see the variant polio virus across that African belt, sort of from Nigeria all the way over to the Horn of Africa. And just last week, the 5 countries in the Horn of Africa, which include Nigeria, launched a synchronized National Immunization Day to collectively immunize children in those countries, largely along the borders, to stop that cross-border transmission. And Nigeria is key for polio eradication because when Nigeria is affected by polio, they tend to export the virus to many countries. So Nigeria alone in 2024, 2023, exported the virus to about 23 other countries across the continent. So our real focus in Africa is really getting Nigeria and the Democratic Republic of Congo cleaned out. So that's the status of where we are in polio eradication. Making progress, evolving, adapting, innovating to the current challenges. And then what is Rotary's role? How are we supporting, how are we leading this effort to achieve an historic goal of eradicating only the second disease in history, as we heard earlier today, after smallpox? Of course, fundraising is an important element. We have a relationship with the Gates Foundation, and I'm pleased to say that we are finalizing our negotiations with them to extend that agreement through the lifetime of the current strategy, which is 2029. We ask clubs to donate $1,500 a year, and I'm not sure how well that is known. That seems to be a fairly well-kept secret. We ask, and so I ask everybody here to go back to your club and say that is a request of the Rotary Foundation trustees that we contribute $1,500. Individual donations, of course, are appreciated, and for our district governors, 20% district designated funds are requested, and that gets matched by the World Fund. But I have to say, I talk about fundraising here, but these are 3 great fundraising districts. Last year alone, with the match from the Bill and Melinda Gates Foundation, it was over $750,000 for these 3 districts, so it's amazing. And for this year, you're on track. You're beating your numbers from last year, so you'll do even better this year. So I really, from the bottom of my heart, and on behalf of the children everywhere, I appreciate the support, and they appreciate your support for keeping them safe from polio. And where does that money go? So I've been talking about Afghanistan, Pakistan, and outbreak countries. And that is largely where your contributions to PolioPlus go. You're funding the most critical efforts to immunize the most children possible against polio. We also fund disease surveillance, the laboratories that look for the disease, either in children or in sewage samples. We also fund communications activities, but largely you are funding everything it takes to get vaccines to children, which is really what we are actually trying to accomplish. Another increasingly important role for Rotary members and Rotary is advocacy. This advocacy with governments, not only with, well, let me start here, with donor governments. And the US is one of the largest donors, or the largest donor, to the Global Polio Eradication Initiative, maybe after the Gates Foundation, but a government donor. They allocate $265 million a year for polio eradication. That is directed towards the U.S. Agency for International Development and the U.S. Centers for Disease Control and Prevention. So this is a photo from March 3rd and 4th. We had our U.S. Advocacy Task Force made up of Rotary members around the country who were on the Hill talking with Congress people. They had over 40 meetings to sustain that funding as we go forward. So we have an ask for 2026 of the $265 million, and we'll be back on the Hill in May, holding our annual congressional reception, but also, again, meeting with Congress people to help us sustain that funding. And we are doing this kind of work not only in the United States, but in other donor governments like Canada, France, the UK, Australia, Japan, any potential donor. And I have to say it's interesting, the evolution of funding for polio has been interesting as we see some of our traditional G7 donors reducing their contributions. We're seeing other donors like Saudi Arabia step up. And Saudi Arabia just made a $500 million commitment to polio eradication at the end of February. I think it was on my birthday, but it wasn't for me. But both WHO and UNICEF have received their funds from Saudi Arabia. It doesn't come to Rotary. So that's good news. Another role for us is advocacy with the polio-affected countries. We're working, we have Rotarians are in Pakistan, they're in Afghanistan. We have Rotarians in Africa, and they are charged with meeting with their leaders, their national leaders, to advocate for the cause of polio eradication. And they do this really on a daily basis. And this photo here is with the Prime Minister of Pakistan as a big supporter of polio eradication, but is getting his political buy-in and using the apparatus that he has at his hands to encourage the provincial leaders to carry out polio eradication activities as well as they can be. So it's fundraising, advocacy, and then raising awareness. And this is day 2 of World Immunization Week. So this is a great week to be raising awareness about polio eradication, not only about Rotary's role in polio eradication, but about the historic opportunity to finish the job. So there's a wonderful toolkit on endpolio.org that has all sorts of resources that you can use to promote this in your clubs in the district. And we also do this around World Polio Day on October 24th. So we call these our 2 tentpole moments during the year where it's really a great opportunity to raise awareness about polio. And of course, this awareness raising is done by Rotary members around the world. And I'm always struck by the creativity of what Rotarians will do to raise awareness. They'll jump out of planes, fly around the world, paint trucks in Pakistan and India, just great engagement through Rotary members. And this was from Singapore at the convention in 2024 when Rotarian Tayyaba Gul, who is a Rotarian and a frontline worker in Pakistan, and she's working up in the north in a very, very conservative area. And she told her story about how difficult it is to be a woman in Pakistan in a conservative community working on polio eradication and how fearful she feels sometimes, but why she is so dedicated to the cause. So it was wonderful to hear her story And it was an opportunity for Rotary members in Singapore to hear her story. And there'll be somebody telling a similar story in Calgary if you happen to be there. So getting to the end of my presentation, I mean, there's so much for Rotary members to be proud about in the polio eradication effort. We heard a few of these statistics before. 20 million people are walking who otherwise would have been paralyzed or they're alive because of polio. We've reduced cases by 99.9%, right? And so we have built an infrastructure for polio eradication that is the primary or premier public health infrastructure globally that can be used for polio and other diseases that we care about, like measles, malaria. So getting to the end here, so what do we still need to do? It's a big task. We're immunizing hundreds of millions of children every year against polio, and it takes hundreds of thousands of frontline healthcare workers. In Pakistan alone, there are 400,000 frontline workers immunizing children during one national immunization day. And we have to increase our disease surveillance because we have to know where the virus is and is not circulating, because that's the only way we'll be able to certify the world polio-free. So at stake, if we do not continue the job, if we decide that we're not going to continue immunizing children around the world, within the next 10 years, 200,000 children will be paralyzed against polio. And we started this effort with 350,000 children being paralyzed every year. So it would be a complete reversal of all the progress that we've made. So what can you do as Rotarians? You can continue to fundraise, start a PolioPlus society, advocate, and raise awareness. Use World Immunization Week as an opportunity to tell the world what Rotary has done in polio eradication and why we need to finish the job. Now, this is a little teaser for my workshop. So this is the first child that I immunized against polio in India in 2002. And I got presented with a print of this child in, I think, April of 2024. And it's an extraordinary sort of total circle story. So if you want to hear about that story, please, I'd love to see you at the workshop that's following this presentation. So that concludes my remarks, and I really appreciate the dedication of the district governors here at TriCon, the extraordinary fundraising that you do for polio eradication, for your commitment to polio eradication, and I just want to thank you for inviting me. It's been an honor to speak with you this afternoon.
Thank you very much, Carol. You know, that was educational, it was inspirational. Thank you for sharing your thoughts and your journey with Rotary's efforts and present challenges in the eradication of polio. In recognition of your service, TriCon 2025 will make a contribution in your name to PolioPlus of the Rotary Foundation.